So you're there, you get there with him. Who finds out that the door is unlocked?
We both did.
Okay. And how is it that you go in first rather than him? Who makes that decision?
No one. I
You,
did.
you just decide you're going in. So you go in, and do you make it far enough in so you can see that something's happened?
Not far enough, but I could see.
Okay. How far in do you get?
Like the living room.
You walk into the living. Are you able to see into the bedroom?
Yes, sir.
And are you unfortunately able to see that Paula's on the floor?
Yes, sir.
Okay. At that point, do you walk back out and get the officer?
The officer grabbed my arm and took me outside.
Okay. And once that's happened, do you stay outside and does that same officer go back in by himself?
Yes, sir.
And how long do you think that officer is in there by himself?
Not that long.
Well, like,
About 10 minutes.
okay. And is there a point when another officer finally shows up?
Yes.
And do you remember if the second officer shows up, is he the guy that ends up taking pictures?
No.
No? Okay.
Nobody.
Okay. So you go in, you see Paula, the officer grabs your arm, takes you out,
Yes, sir.
and then that officer goes in and he's in there by himself for like 10 minutes.
Yes, sir.
And then finally another officer comes in. Does that officer go in with the first off? Does the first guy come out, or does the other guy go in and join him?
He goes in there and joins.
Okay. And I'm imagining, because this is a very traumatic day for you, your memory of this day is pretty. Yeah, I mean, you haven't experienced anything like this in your past. Unfortunately for you, you've never experienced anything like this before.
Yes.
That's all I have, Judge.
All right, state.
No further questions, Your Honor.
All right, is this witness excused?
Yes, Judge.
All right, just leave the microphone behind, please. State, call your next witness.
Your Honor, state calls Dr. William McLean.
I'm sorry, who?
Dr. William McLean.
Okay. All right, if you can raise your right hand. Do you solemnly swear or affirm the testimony you give will be the truth and nothing but the truth, so help you God?
I do.
All right, you can lower your hand. If you'll pick up the silver microphone that's there and place it somewhere on your jacket or tie, it's for the court reporter to hear. Make sure you keep your voice up, and if you'll state your name and spell your last name for the jury, please.
Sure. I'm William McLean, and that's McClain.
Daryl, is your microphone the bench? That one. Thank you.
All right, state, you may proceed.
Okay, sir. And so what do you do for a living?
I am a forensic pathologist and a medical examiner.
Okay, and how long have you been both a forensic pathologist and a medical examiner?
For about 13 years.
And if you could please, could you elaborate your education and training that led to your becoming pathologist and a medical examiner?
Sure. I graduated from the University of Texas in Arlington with a Bachelor of Science in Biology. Then I obtained my medical degree from the University of Texas Health Science Center in Houston. And then I completed a combined anatomic and clinical pathology residency at the University of Texas Health Science Center in San Antonio. and then a one-year fellowship in forensic pathology at the Bexar County Medical Examiner's Office, which is obviously here in San Antonio as well. I'm board certified in anatomic pathology, clinical pathology, and forensic pathology.
Okay. And your practice, since you got all those, the degrees and the board certifications, is there even specialized training once you get your medical licenses for the board certifications?
Yes, sir.
Okay. And what exactly does a medical examiner do?
No, I do autopsies on people when they die suddenly and unexpectedly within the geographic jurisdiction where I'm working. Bexar County is an example of a medical examiner's district. So when people die an unattended death, meaning that there's not a physician who knows what happened, what kind of natural disease might have killed the person, or if the death is obviously a non-natural death, then the task of determining the cause of death and signing the death certificate with the proper cause and manner of death falls to the medical examiner.
And where have you practiced as a medical examiner before?
I worked for 3 years in Dallas at the Dallas County Medical Examiner's Office. Then just about 5 years, a little more than 5 years here in Bexar County at the Medical Examiner's Office. And now I've worked in Nashville and Beaumont, Texas for almost 5 years.
And just so I guess I'm try to be accurate, and you are an assistant medical examiner.
A senior assistant medical examiner, yes, sir.
Okay, thank you, sir. Where were you working in the summer and fall of 2015?
At the Bexar County Medical Examiner's Office.
Okay. And is when a body is retrieved, somebody, law enforcement comes across someone, a crime occurs, what's the process of getting that body from the field back to the medical examiner's office where you do your analysis?
The first step is that death is reported to the medical examiner's office. So an unattended death, someone stumbles upon a deceased body in a home, outside, wherever. Police are notified, and then they respond to the scene. Maybe EMS personnel respond, they declare the person deceased. Then usually a law enforcement agent will contact our office and say, we have someone we believe falls under your jurisdiction. Here's the quick synopsis of what led to this person being discovered deceased. Then our in-house investigator, the medical legal death investigator, who works for the Bexar County Medical Examiner's Office, decides whether that is or is not our case and whether we will or will not accept jurisdiction of that decedent and the investigation into the cause of that person's death. It's determined that it is indeed our a medical legal death investigator from our office will go to the scene, camera in hand, and notepad and pen, and we'll take notes and conduct interviews of the law enforcement agents, witness, whomever may be there. They will document photographically the scene and the condition of the body. And then we contract with body transport people, companies that specialize in transporting bodies. They put the body in a pouch or a body bag, and it's transferred to the Bexar County Medical Examiner's Office and placed in what we call the incoming cooler, the big room-sized refrigerated room where the bodies are kept on tables from the time they come in until the next business morning when we begin our examinations at 8 o'clock in the morning. Then with that is when we start our exam, but in the interim, once the case has been accepted and the investigator is back in the office, he or she will then type up what we call an investigator's report. And that's available to me in the morning when I start my examination. I've already read through the investigator's report that my in-house investigator provided.
Okay. And so that entire process, notification, deployment of a representative from your office, the collection of the body, storage, examination, then report. Is that process followed all the time?
It is, yes, we have a well-established standard and routine.
How do you document the findings and observations that you make during the examination?
During the examination, I have clipboards with different diagrams of body parts, body regions, or the whole body, what have you, whatever I need. So I make notes during the autopsy and upon immediately after the completion of the autopsy with the dry erase board where I've kept notes throughout. Transfer that to my paperwork back to my office. I dictate it into a Microsoft Word document. Then that I read through that, I edit that, and I have it ready once all of my studies, all of my tests, everything, all the information I need, any medical records, police reports. Once I have everything I need, can take several weeks sometimes, then I go and finalize the report, making whatever additions I need to along the way. And once it's finalized, printed up, and I sign it, and then it's made available to whoever needs that.
Okay, and do you capture everything you described? Do you capture that in a report of some type?
I do, yes, sir.
Would looking at and did you follow that, did you perform an autopsy on Thursday, October the 22nd of 2015?
I think I did.
Would looking at a copy of your report from that procedure help to refresh your recollection and support your testimony here today?
Yes, sir.
Mayor Pro Tem.
Yes.
Doctor, I'm showing you what has been marked as states exhibit or 53 Charlie. Take a look at states 53 Charlie.
Okay.
And what is 53? Is that a copy of your report?
It's a copy of the autopsy report that I generated, as well as the investigative report that was provided by our in-house investigator.
Okay. And along with the examination you perform, do you, and the written report, do you also document that?
When necessary, and specifically for this autopsy, I took photographs.
You took them yourself?
I did, yes, sir.
Who was your investigator that went out and retrieved this body in the process you described?
It was, Jerry Leva.
Okay.
Jerry Leva made this investigators, Bashan, who was tagging along with Jerry Labor.
All right, so you had two representatives of the medical examiner's office there that day.
Yes.
And had, and is it your, are you aware, is it also common investigators take pictures out in the field as well?
Yes, sir.
Are those pictures that your investigators take in the field, are they also considered as a part of your autopsy?
They are.
So we will move between some photographs and taken and your report, etc. Looking at the first page of your report, how do you document this particular? Well, first off, who was this autopsy performed on?
Paula Boyd.
Okay. And at the time of your examination, what date and time did you conduct it?
October 22nd, 2015, and I began at 9 o'clock in the morning.
And do you, for the case itself of performing an individual autopsy, is that does that have a designated case number?
It does.
And what case is that?
This autopsy was case number 2015-2243.
Okay. And what is the demographic information for Ms. Paula Boyd?
She was a 75-year-old white woman.
What did you determine just on the size, weight, and what were the general observations made?
Sure, she was 151 pounds, and she measured 63 inches as she lay there on the table. The body came to our office nude. She had no jewelry or anything else there on her body at the time of the exam. She did have rigor mortis, but it was easily broken, easy to break the rigor, and she had fixed posterior lividity, meaning that it was on the back. A black and gray scalp hair that was about 5 inches long at the most. The eyes were brown. Everything seemed normally formed. Ears, nose, lips. Teeth were in good condition. That sort of thing.
Okay. Now you used some terms. You said rigor mortis is present in the extremities but easily broken. What does that mean?
Rigor mortis or rigidity is the stiffening of the muscles. Maybe you've heard of through movies and such, but when a person passes away, the chemicals that are in the muscles that help them contract and move, they will still be present for some time before they naturally decay and go away. So immediately upon death, the muscles start to stiffen up. They can no longer exchange the proper molecules to release and to contract. And so they will stay in the position they're in at the time of death if the body is not moved. And so with time, this rigidity becomes stronger and stronger and stronger, and it's more and more difficult to move the body. But then after a certain amount of time, after a peak, and that process, natural decay continues, then it becomes easier to move the muscle. So it's sort of a peak and upward, a peak and then down.
Now, those observations about the ease of which you can move the muscles of the body you're examining, why is that important in your field, in your line of work?
We mentioned it in all of our reports just to provide any kind of insight estimates as far as time of death. That's where it's most helpful. It's also helpful to note position of rigor mortis because that helps us to know if a body maybe had died in one certain position, but then when discovered or when seen, if that rigor mortis doesn't match up with the position the body's in, then we would know that that body had been moved.
How was the body transported from the field into the medical examiner's office? And I believe you said it was a cooler where they're stored.
There at the scene, our investigator brings with him or her, in this case him, Mr. Leva brought a body transport bag with him, as well as a clean white flat sheet, like a bed sheet. So at the scene, once the documenting and everything is done, and it's time to remove the body, then the body is wrapped in the new clean white sheet and placed inside the body transport bag. It's zipped, it's sealed with sort of a zip tie, kind of a contraption that has a serial number on it. So the two zippers on the bag are brought together and sealed that way. Then that body inside the body transport bag is put on a gurney and then wheeled out to a waiting vehicle, usually a big van, big kind of box van. Body is placed in there and then transported, driven over to our office, and then unloaded from there and rolled into the building and put into the incoming tour.
Once you begin your medical evaluation, what is the first step that you take?
The first thing we do is we unzip the bag. That seems rather obvious, but we unfurl the top of it and we take what we call as-is photographs. And these are photographs to document the way the body appears as is when first viewed in our morgue. So obviously this is not as first viewed at the scene or anything like that, but this is as presented to me when I first opened the bag. And then from there, we remove medical paraphernalia, EKG leads, tubes, whatever may be on the body. We will collect any kind of trace evidence. If there's hairs, fibers, paint chips that may need collecting. As we go along, we're taking photographs to document all of this, and then we remove the jewelry, the clothing, those sorts of things, if any are present. Once we're done and we've collected all of the evidence we need, any kind of DNA swabs or fingernail clippings, then we will wash the body down to remove any kind of dirt, grass, debris, blood, whatever the case may be. Once we're done with that, we will begin our internal examination.
Approach, Your Honor.
Yes.
So I'm going to show you what has been marked as state's exhibits numbers. Seven, 27. Hang on, I apologize. I got them out of order. Oh. State's exhibit numbers 25. Apologize, Judge. 27, 28, 29, 30, 31, 32, 33, 34, and 35 for identification. If you would take a moment and look at those exhibits that were just named. Are they all part of the examination you performed?
Yes.
Okay. Now, the same thing with State's Exhibits 36, through 43 for identification. Same question.
Yes.
In states 44 through 52 for identification. And finally, states 26.
Yes.
Attended to the defense for inspection states 25 through 35. States
No objection to 25 through 38.
states
All right, states exhibits 25 through 35 are admitted without objection.
states 36 through 43 for identification.
Objection to 36 to 43.
You say to 43?
36 through 43.
All right, states exhibits 36 through 43 is admitted without objection.
And finally, states 44 through 52 for identification.
No objections on 44 through 52, Judge.
All right, states exhibits 44 through 52 are admitted without objection.
No. Doctor, on the bottom of page 1 of your report, You talked about, what did you find about the extremities?
I described them as being symmetric and normally formed, and the fingernails were intact.
Okay, and initially, they came in, the hands were bagged, showing states 25. And I'm also presenting states 27 and 28. Why are the hands bagged?
But the hands are covered in brown paper bags in order to preserve any kind of evidence, trace evidence that may be there on the hands. Often during transport, they brush against things, as bodies are turned and moved. So in an effort to keep any kinds of hairs, fibers, or any other trace evidence that's on the hands, in order to keep them on the hands, we'll cover the hands with a paper bag so that if anything does fall off the hands, it is at least captured by the bag.
Okay. And then states 29.
This is a photograph of her left hand after the paper bag has been cut open, but it is still in place around her hand. In this photograph is just to show, again, sort of an as-is view of the hand when we first removed the bag.
That same thing with states 35.
Yes, sir, this is of the right hand.
Okay. At the bottom, you mentioned the fingernails are intact. States 30.
Yes, sir, this is a photograph of the left hand and specifically the third, fourth, and fifth fingers of the left hand. You can see the fingernails are intact, but this photograph does demonstrate some injuries to the.
And the injuries to the, is this what you're referring to?
That is one injury, yes, sir.
And from your general knowledge, what could cause that type of injury as you see on the third finger primarily of the left hand?
Well, yeah, actually, what we're seeing here, the it's called the middle finger is the third finger. What's called the ring finger is the fourth finger. Specifically on the third and the fourth fingers, we see scrapes of the skin causing abrasions even on the inside of the fifth finger, a small little scrape here. And then there's a little bit of kind of a ecchymosis or hemorrhage in just beneath the skin on that fourth finger on the ring finger.
Okay. From your experience, doctor, what could cause that type of discoloration?
Hemorrhage beneath the skin.
What causes the hemorrhage beneath the skin?
A blunt impact of some sort. So either striking an object or a hard surface, a firm surface, or a firm surface or a hard object striking the hand. These are the kinds of injuries on fingers like this are often referred to as defensive type wounds, or the kinds of wounds that are sustained when somebody.
Looking at states 34, excuse me. And do you see a similar type injury on the right hand?
I don't see any in this photo, no, sir.
Are the nails of the right hand intact?
They are. We can't see all the nails in this photograph, but they were intact during at the time of the autopsy. They had not been broken or splintered off or anything like that.
On stage 33.
This is back to the left hand, and it's primarily showing the thumb and that sort edge of the second finger and that web space between the thumb and the second finger. No injuries here, and that thumbnail is intact.
I apologize. I meant to go 31, the right hand. I'm sorry that, yeah, it's the right hand.
Sure, this is a photograph similar to you, but of the right hand, again showing the thumb and that edge of the index finger and the space in between. And no particular injuries noted on the right hand.
Stage 32.
This is a sort of a palmar view. See that the fingers are still clenched over. This is on the right hand. Now you will note, if you look at the fingernails, this photograph was taken after we had trimmed the tips of the fingernails. So we used sterile clippers and cut those the fingernails back just as far as we can to get as much of the tips of those fingernails, collect them in a sterile packet and preserve them for potential studies, DNA studies, whatever may be needed on them. So you can see sort of the cut edges of those fingernails now, but that is a post-mortem or an after-death thing that we did. But this photograph shows that there's essentially no injuries to the palm of the right hand.
Thank you for correcting me on that, doctor. I did not mean to mislead, but your analysis, your report says when you first opened the bag, all the nails were still intact.
Yes, sir.
Okay. What else was, looking at page 2, the head and neck, what else was clearly apparent in your examination, cursory look?
Sure, as soon as beginning the exam, it was obvious that the decedent has sustained multiple traumatic injuries to the face and neck.
Can you describe them in particular with any specificity?
Sure. To the left eye, we sort of start beginning with the eyes. We see that there's hemorrhages on each of the eyes, on the eyelids. We look for petechial hemorrhages, and there were some hemorrhages on the left eye, subconjunctival, meaning that there were sort of so many petechial hemorrhages that they all ran together and appeared as one larger area of hemorrhage on the bulb of the eye, the bulbar conjunctiva. And then there were abundant fine and coarse, so small and sort of medium-sized pinpoint petechial hemorrhages that were scattered over the not only the bulbar conjunctiva, but the eyeball, but also on the underside of the eyelids, and we call that palpebral conjunctiva. The right eye had a few fine pink petechia on the eyeball itself and also on the eyelids, and not as many as on the left side. The forehead had a faint pink contusion that was sort of here at the hairline where the hair and the forehead meet on the upper left side. The nasal bridge was depressed, pressed inward with a obvious fracture. There was a small laceration right there over that fracture point, presumably from the fractured bones poking through. The inside lower part of the right eye had a pink contusion kind of in that recess of the right eye. There were some more abrasions, which are scrapes of the skin that kind of went off the right side of the nose. The underside of the tip of the nose had a small abrasion as well, a little scraping under there. And then the left side of the upper lip was split open, large laceration or tearing of the inside of the lip and what's called the vermilion border, sort of where the skin and the lip meet. Pretty much all of it was just shredded with a large degree of laceration. What else? The lower lip also had full thickness lacerations across that vermilion border and onto the inner surface. The medial right side of the chin had a red abrasion just below the lower lip. There was a perforating laceration that sort of pierced all the way through, not really the lip, but kind of a little higher. But it pierced all the way through into the oral cavity, kind of through the cheek. There were bruises across the right cheek at the angle of the mandible, the area just in front of the ear on the right side of the face had some abrasions that extended onto that right external ear. Abrasions meaning scrapes of the skin. What else? That was it as far as the external examination of the face.
All right, doctor, and didn't want to try to interrupt you. I'm introducing what is publishing what's marked as States 42. And what's visible States 42? Does your report, is this on her left cheek? What is that?
That's well, you can see the skin there at the angle of the mandible has been scraped, but it's also very distorted and distended, swollen. That's swelling from trauma that's been inflicted to the face, and that's causing that big bulge on the left side of the face.
In your experience, what type of mechanism could cause that type of injury?
Sure, it's clear that there's been blunt impact to the face. So again, either a blunt object, and that's best to explain what a blunt object is by saying that it's not a sharp object like a knife, and it's not a bullet, not a gun, but it's a heavy object with a more or less dull surface, baseball bats, fists, boots, a variety of objects, either struck the face or her face struck an object, which could even include the floor as being an object that might be struck by the face.
And then the swelling around the left eye, does that, from your experience, does that look like part of the same blow or separate?
Well, it's most likely separate blows. It's clear with this abrasion down there, the angle of the mandible, that's one impact site, and there's swelling there. But then the swelling around the eye seems to be a separate and distinct entity in and of itself. Plus, she's got the trauma to the eyeball and the eyelid as well, indicating a blow that went directly to the eye.
Okay. And your report mentions the nasal bridge is depressed and fractured. Is that what I'm circling here on the exhibit? Is that what you writing about?
Yes, sir. And you can see in this photograph the irregular contour of that nasal bridge, which is the part of the nose kind of between the eyebrows, just below there, between the eyes. You can see the irregularity. You can see the purple discoloration from the hemorrhage beneath the skin. You can see the laceration that is right over that fracture site.
I'm looking at, we're now publishing States 46. And what is States 46 showing?
The States 46 is a photograph taken from the front left side of the decedent's face. You can see the forceps and a gloved finger are holding the left upper eyelid up and reflecting it so as to show what is on the underside of that eyelid. We see areas of hemorrhage, especially medially or towards the nose, towards the midline. On the upper eyelid, you could see the left eyeball itself, the orbital globe, the part that is usually white, the sclera, has been obliterated. There's no more white, but rather confluent hemorrhage there. You can also see on to the left side of the photograph, you can see that laceration over the nasal fractures, the fractures of the nose again. And you can also appreciate the swelling on the inferior and lateral aspects of the left eye.
And when we spoke earlier about the blunt force trauma to the cheek and jaw, would that also cause what you see in the left eye?
Well, again, the swelling on the underside of the left eye certainly could be related to the same hemorrhage that is on the left eyeball itself from a direct trauma there. I believe that that's distinct and separate from the large swollen area on the left side of her face along the
It's more the same.
But yes, this time in this photograph, you see the forceps are reflecting the lower eyelid, so as to demonstrate the petechial hemorrhages, the tiny little fine pinpoint pink and red areas.
Now showing states 44 and 47. What does your report say about 44 and 47, the right eye?
And these photographs are of the right eye. You see one is where the forceps are reflecting the lower eyelid, the other reflecting the upper eyelid to demonstrate the petechial hemorrhages on the underside, especially on the lower eyelid on the right side. Of course, you can also, again, see abrasions on the nasal bridge. You can see the nasal fractures and the laceration overlying those fractures.
But the petechia, and what is the definition of petechia?
A petechia is a small little area of hemorrhage caused by the rupture of a capillary. Capillaries, if you think of veins and arteries coming from different directions, and they gradually go from large to small, the veins and the arteries, and where they meet, and the vessel transitions from an artery carrying oxygen to a vein where it no longer has oxygen. That area where the oxygen is released to the tissue is in an area called capillary, and that's where the blood vessel is only one cell layer thick, maybe two cells thick, very thin walled, and that allows this exchange of oxygen out and waste in so that it can be transported. So when there is trauma, especially pressure put on the blood vessels that do not allow the blood to drain from those capillaries back through the veins, oftentimes because of compression, then we get rupture of those little thin walled capillaries. They're very delicate, and they will rupture when the pressure gets too high. You think of a water balloon that ruptures when it's overfilled, or a dam bursting through its barriers and then flooding out into the surrounding areas.
But the right eye looks, is that same mechanism of injury what you saw in the left eye?
Yes, in a general sense. So the left eye had the fine pink petechia scattered all over, plus larger areas of hemorrhage. Large areas of hemorrhage seem most likely to have come from a direct blow to the eye, whereas the fine petechia on the left eye and on the right eye were most likely associated with a compressive nature somewhere to the neck, upper body, the drainage of blood from the head back to the body, causing petechia.
Looking at states 43 and I want to focus on the mouth and the lips. Looking at stage 43, why is her tongue sticking out, protruding between her legs?
In this photograph, that is not her tongue coming between her teeth. That's That's her lip. What we see going horizontally in this photograph is a full thickness laceration that is torn almost entirely through the lip and has almost separated this superficial most sort of layer of her lip from the rest of her lip. So admittedly, it does look like a tongue in this photograph, but it is simply just sort of that upper rim of her lip.
I apologize, thank you. And states. Oh, and you had mentioned earlier from the top of page 2, is this the perforation you had mentioned in your top paragraph?
It is. That's the laceration that goes all the way through, outside to inside, to the upper lip.
Same states 39, and so that is the inside of her lip.
Sort of inside or the crown of the lip, however you might call it. It's the vermilion part of the lip. It's that delicate pink part that becomes flushed when we're embarrassed or what have you. Generally speaking, a good way to maybe define it is it's the part of the lip that lipstick is applied to. And so there's a laceration right at that border between the sort of ordinary skin and that part of the lip.
States 52. What is states 52 showing us?
This is a photograph of that lip reflected. And now in this photo, we do see the tip of the tongue. It's right there at the teeth. But this photograph is to show the large gaping laceration through that part of the lip and demonstrating the extent to which it's torn open.
And right here where I have my pen, what are these her teeth?
Those are teeth, yes, sir.
Lower teeth?
Yes, sir. And then the what appears white in this photograph is her gingiva or the gums where the teeth are.
And this here is, what is this that I've now circled on states 52?
That's the tip of the tongue.
All right, so this is tongue.
Yes, sir.
Okay. States 50.
And this photograph is still the lower lip, but now demonstrating more the left side and inside left side of the lower lip where there's hemorrhage into that tissue coming from the laceration.
Right, and we've discussed our teeth under here. This is what?
That's the tip of the tongue.
And so are these our top teeth on top of that?
Yes, sir. Just peeking out from beneath her upper lip.
Does this picture suggest that the tongue is trapped between her upper and lower teeth?
It is.
States 51. What is shown in states 51?
This is the upper lip reflected with the forceps and a gloved hand, showing several lacerations across the inside of the upper lip.
And on the lower lip, you call that a tearing of the fascia?
No, not the fascia. Just that intermucosal surface of the lip.
Okay. And again, states 38. What's visible off of states 38? What?
This is a photograph of the left side of the decedent's face, chin, neck. You'll see at the top of the photograph is her left external ear for orientation purposes. Her mouth is here, sort of in the lower left side of the photo. What we're seeing is several abrasions and contusions that are across the left side of her neck, kind of in a horizontal pattern. We can also make out in the area that's sort of just on the front base of the neck, in that sternal notch, we can see some abrasion there too.
What is this discoloration down here underneath the neck?
Yeah, that's the abrasion I was just referring to, scraping of the skin.
And the redness on the left cheek and face?
All right, bruising and abrasions or scrapes of the skin on that left edge of the mandible that we're seeing, and extending onto the left side of the neck.
Stage 36.
This is a photograph taken from the front as she's lying on her back. Again, it's showing that abrasion or scraping of the skin on the front base of her neck.
And from your experience, what is the mechanism of injury to cause that type of abrasion?
Yeah, the skin has been scraped by a blunt object of some sort. Combined with the bruising on the neck and the peaking on the eyes, these are all injuries consistent with a strangulation, a compression of the neck.
Stage 37. Do you see that same type of injury from the right side of her neck?
Yes, this photograph is kind of the right shoulder, right upper chest area. And the center upper portion of the photograph, we can see this abrasion again on the front side of the neck for orientation purposes. We can see in this right side of the upper chest, over the right clavicle, there's purple bruising with some scraping of the skin. Another small little scrape of the skin a little further down on the chest. We see a little bit of contusion sort of on the apex of that right shoulder. And even at the upper center of the photo, we can see sort of a curvilinear red bruising that was on the right side of the neck, sort of under the right side of the jawline.
Stage 41.
This is a photograph of the right side of her face. We can most obviously make out her right external ear, which is on the left side, left center of the photo. It has been scraped over. You see sort of the apexes are scraped, whereas the deeper portions are not so much. It tells us that she scraped over a surface, or a surface scraped over her. That abrasion continues onto the right side of the face, just in front of the right ear. And we see another abrasion a little further down toward the jawline. The right side of the face is mostly occupied by a purple-red contusion that you can see there amidst those abrasions. And we see some generally horizontal linear abrasions and contusions that sort of stream from over the right side of the face across the mandibular line or the jawline and onto the right side of the upper neck.
And the pictures that we've just published, is all of that encapsulated on page 2 of your report?
There are some of those injuries are documented on page 3 as well, but most are on page 2.
Okay. So just off those injuries that we've seen published and that you've described on page 2, overall, what would cause those visual injuries?
Blunt impacts to the face, to the neck, to the upper chest, as well as compression or strangulation with compression of the neck structures.
Going to page 3 of your report. you turned to the trunk of the body. What did you find at the trunk of the body?
Well, externally, I saw that the right shoulder had pink contusion near the base of the neck, and there was another pink contusion over the right clavicle, as we saw in the photographs, and then a small little pinpoint abrasion near the sternum.
And I apologize. If you would, what did you observe looking from the base, the last sentence on page 2 through the top paragraph of page 3? What did you observe?
There were vascular dissections. Actually, I dissected out the blood vessels of the neck and saw that there were lacerations or tears of the internal jugular veins at their inferior regions, close to where they come out of the neck. Both of those had been torn. And there was hemorrhage into the tissue around the cervical vertebra. That is the vertebra that you can sort of feel, the most prominent one there at the bottom of the neck, going down your back. That vertebra had been fractured and was had a stair step configuration, is what we call it, with the vertebra below it, which is the first thoracic vertebra. So it had been fractured, and they had moved apart from each other and sort of had this stair step configuration after having been entirely fractured. Along with that fracture, the spinal cord that passes through that area was also fully transected or torn completely through. And there was hemorrhage in the spinal canal and in the muscles and tissue around the spine.
So what would be the effect of that type of injury, the stair step completely fractured and the spinal cord transected? Does that mean torn?
Yes, sir.
What would be the effect of that type of injury?
She would have been paralyzed from the lower neck down, from the shoulders down.
Looking through at injuries that you found in the trunk from below C7, what did you find?
Internally, I saw that the left first through 8th ribs and the right first through 7th ribs had hemorrhagic fractures. They were broken. There were broken ribs with hemorrhage around them, around the fracture sites. The soft tissue of the center of the chest had hemorrhage in that tissue around the spinal, around the spine. The left chest cavity held about 380 milliliters of blood, and the right chest cavity had approximately 260 milliliters of blood. And then the front edge of the liver, which sits kind of in the upper left side of the abdominal cavity, it had a small laceration as well.
So it would be fair to say she had 15 rib fractures.
Yes, sir.
From your experience, what would be the mechanism of injury to cause that many rib fractures at a time?
A heavy force was directed onto her chest that compressed the center of her chest inward and caused those ribs then to buckle and fracture.
From your experience, would 340 pounds be sufficient force on the chest and torso of a 75-year-old woman?
Yes.
From looking at, give me the previous pictures. And beyond may I approach the witness, Your Honor?
Yes.
Does your report, beyond the pictures you take and the reports you write, do you also produce a graphic overlay of the body that summarizes the injuries?
I do.
Showing you what is marked as State's Exhibits numbers 54 and 55 for identification. What are States 54 and 55 for identification?
These are what we call injury diagrams. They're just sort of a generic outline of, on one page on Exhibit 54 is the outline of a human head, face, and then on 55 is the outline of an entire human body. And we use these just to sketch out the injuries to make it easy to refer to them.
Okay, and so would it be accurate to say that 54, the head injuries, and these, you annotated these, marks on 54?
I created that, yes, sir.
Okay. Would it be fair to say that 54 and 55, the diagram, show what we've gone over in detail with the previous picture that you documented the actual injuries?
Yes.
Tender states 54 and 55 to defense for inspection and move to introduce 54 and 55 into evidence.
No objections.
And what numbers were those?
54 and 55.
All right, state's exhibits 54 and 55 are admitted without objection.
So, doctor, with what the injuries you observed in the trunk with the 15 rib fractures and all the abrasions to the left side of Miss Boyd's face. Now, I previously asked if someone approximately 340 pounds sitting on or straddling her chest or however that could cause the 15 rib fractures. Do the blows to her left side of the face, if they were facing their assailant, that indicates somebody striking with the right hand? Is that possible?
That's possible, yes.
Aside from documenting evidence of injury, both internal and external, what else do you do in the process of completing your autopsy?
We'll still conduct an entire internal examination, complete the rest of the autopsy, and document whatever sorts of natural diseases are present as well.
Did you find any evidence of natural disease or anything that could have contributed to Miss Boyd's death? Anything so acute that it would have contributed to her death?
She had hypertensive and atherosclerotic cardiovascular disease, which is quite mild. She did not even have an enlarged heart, just a minimal, mild narrowing of the coronary arteries. But none of it was to such a degree that she would be expected to have died of natural diseases anytime soon.
Aside from the examination, did you also collect any evidence from the body?
I did.
And what type of evidence do you collect?
So we collected the fingernail clippings from both hands that we mentioned before. Also a sexual assault kit, which includes combed pubic hair combings, known pubic hair standard that we plucked. Also the same combed scalp hair and pulled known samples of scalp hair, we saved those. And then swabs of the oral, vaginal, and rectal cavity.
Just a moment, doctor. Your Honor,
Yes,
apologize to the court for my inefficiency. Might be better if you give the jury a short recess while I get the appropriate exhibits marked.
all right, ladies and gentlemen, I'm going to give you a 15-minute break. Remember my previous instructions, not to do any research. Everything that you need to know about this case is to come from inside the courtroom. Do not even think about this case unless you're in the courtroom. Does everyone understand? All right, everyone, please rise for the jurors.
Okay, got it, got it.
You still need this?
All right.
He's got his.
Oh, I did?
No, you left it on the. Oh,
All right, everyone, please be seated. Stated still your witness. You may proceed.
Doctor, before the recess, talked about how you collected evidence from a body. And how do you do, would you describe that process again?
Yes, we collected fingernail clippings using sterile clippers into a sterile piece of paper and packaged in an envelope for each hand. We also did a sexual assault kit, which involved the pubic hair combings and pulled known pubic hairs, same for the scalp hair, and then swabs and smears created from the oral cavity, the vaginal cavity, and the rectal cavity.
Okay. May I approach, Your Honor?
Yes.
Doctor, I'm showing you an envelope that has been marked as State's Exhibit number 56. And inside the contents of State's 56 is a plastic bag that contains a number of, I guess, sub-exhibits.
All right, defense, you may move about. And do you need gloves as well?
Okay. And so there's an envelope marked as States 56A. And if you could, what is States 56A?
This is what we call a coin envelope, and it contains the fingernail clippings from the left hand and from the right hand, as well as the clippers that were used to trim them.
Okay. And how do you know that these are the clippings that you took in the conduct of the autopsy on Ms. Boyd?
This envelope is labeled with stickers with her case number.
Okay.
And her name.
All right. And you placed them in yourself?
We did, yes, sir.
Okay. How many swabs do you collect?
We collect swabs from the oral cavity, vaginal cavity, and rectal cavity. So, but 2 sets from the vaginal cavity. So that would be 8 total swabs in 3 containers.
Okay. Showing you what has been marked as swabs, 3 containers. They've been banded together, both with the exhibit States Exhibit 56B. Examine States 56B. Does that fairly look like the swabs you collected in the autopsy you conducted on Ms. Boyd?
Yes, sir.
And how would you testify to that?
Each one is labeled with her case number, her name, and what it is.
Okay. And then there, and then there are 3 flat containers of wrapped in cardboard, identified as dry specimens smears, 3 of those, and they are marked as States Exhibit 56C.
Yes, these are cardboard slide holders. So there's 3 of them here. Each one contains 2 glass slides, like microscopic slides. So after those swabs, cotton-tipped swabs have sat in each of the respective cavities, I pull them out one at a time and smear each one on separate, clean, sterile microscopic slides, and then set the rectal one aside, and then do the same for the oral and do the same for the vaginal. So we have swabs, and we have what we call smears, where we take that cotton swab and smear it onto the glass slide. So there's 3 of those, 1 for oral, 1 for rectal, and 1 for vaginal.
And then finally, you also mentioned combings, and we have a number of envelopes marked states 56D. What is that?
So these are, are they all labeled D or? is each one separate?
56D is one, 56E, 56F, and 56G.
Sure, so D as in dog is the combed scalp hair, and that is a piece of paper placed beneath her scalp hair and with a sterile new plastic comb used to comb any kind of debris out of her hair and onto the paper. The paper is folded up along with that same plastic comb, and it's put in this envelope. I can feel the comb inside. It's labeled with her case number and what the specimen is. 56E as an elephant is the pulled scalp hair. And so this is again with the sterile piece of paper and plucking representative hairs from different regions of the scalp and placing into the paper and into the envelope and sealing it. And then that process is repeated in what is labeled as F and G. F is the combed pubic hair, same process with the comb that you fill inside the envelope. And then G is the pulled pubic hair, same where representative samples of pubic hair are plucked.
And so then, Doctor, the contents of all those exhibits you just discussed, do those consist of the physical evidence you obtained off the body in the autopsy of Miss Boyd?
Yes, sir.
Your Honor, tender states 56 in its contents to the defense for inspection and move to introduce states 56 into evidence. I'll let you inquire.
Yeah, inquired. Doctor, 56C versus 56B. These are the swabs to be used, correct?
Now B is the swabs, yes.
And then C are tell me about C.
C is the microscopic slides where each of those swabs is smeared onto their own individual set of 2 slides and placed in this cardboard slide holder. One for the oral swabs put onto slides, we call those smears. Another for the rectal swabs that are then smeared onto the slides, and then another for the vaginal swabs that are smeared onto the slides.
And you did all that yourself?
Yes, sir.
And your initials are on here somewhere? I know you said your tags are on here, but are your actual initials? There's a lot
They
of
are.
handwriting, so.
Yes, sir. This is me, WM.
Oh, okay, I didn't see that. Couldn't
Yes.
tell, I couldn't tell what that was. All right. Now, the rubber bands, I'm assuming those were just put in after the fact. You didn't submit them.
Yeah, I don't remember bundling them in rubber bands. I might have, or the technician might have done that.
And inside of these, there's 2 per
Yes, sir.
sample.
Yes.
And did you package this into this large envelope? I don't see the same initials on this packaging. Or on these, but I don't see it on this.
I did not. This is a label created by the San Antonio Police Department. So this envelope and this label are not from the medical examiner's office.
But these items inside are.
Yes, sir.
Okay. No objections, Judge.
All right, State's Exhibit number 56 with the contents 56A, B, C, D, E, F, and G is admitted without objection. You may continue your direct examination.
Fine.
Do you want them back?
That's where they're gonna go anyway. So, doctor, what's already been. It's 26. Yes. Doctor, showing what's already been admitted into evidence states 26B. What is the purpose of taking that shot?
This photograph is to link the most recognizable part of any person's body, which is their face, with the unique case number that we assign to that decedent.
All right. And you don't establish a name and identity until you have proof in the office, in your office, correct?
Well, that depends. Usually, the majority of people who come to our office for autopsy have been identified. There's usually no reason to doubt their identity. On occasion, people come in completely unidentified as a John Doe. Sometimes they come in tentatively identified, and then in those cases, we can take steps, fingerprints, DNA, what we need to do to establish or at least confirm the suspected identity. I believe that we knew who she was, and I don't think there was any need to prove it with fingerprints, but if needed, we collect fingerprints on every decedent anyways, just in case it is needed.
Just for clarity, this autopsy 2015-2243 was performed on who?
Paula Boyd, I believe that she was referred to as Paulita when I autopsied him.
Right. And that is the party, correct?
Say again, I'm sorry.
This is the person, the body in whom you performed the autopsy that you just testified about.
Yes, sir.
What were your what were your findings overall? Well, we've listed them. What did you conclude to be the manner of death?
The manner of death I classified as homicide.
And about what time did you conclude your autopsy, your examination on October 22nd?
Oh, just having started it at 9, I would just estimate probably around 11:30, somewhere in that range.
Okay. Finally, you previously testified that it's procedure in your office for medical examiner investigators to go to a crime scene and then collect and retrieve the body per your protocol.
Yes, sir.
Now, there's been evidence that at,
Do you want to offer that picture to Mr. Sherman?
it's already been, sorry.
It's not in, is it?
Yeah,
26 is in.
it's been a minute.
26?
Yes.
Yeah.
There's showing you what's already in evidence to State's Exhibit 10. And there's been testimony that the body was initially found surrounded by this bedding, the pillows, etc. And then under State's Exhibit 9, those items have been removed, and there's been testimony, these are the medical examiners, your representatives of your office. How is a body transported? How do your personnel, the investigators, just carry a body out as they are? Do they put them in a container? What happens?
So our investigator is at the scene and brings with him, or with her, in this case him, he brought with him a brand new, never used before transport body pouch or a body bag. It's large, 7 foot long with a zipper that fully opens. But he also brought with him a new clean white flat bed sheet. And there, after he's done with his exam, he would have placed this sheet around the body, on the side of the body, and then rolled the body and tucked the sheet underneath so that she was entirely enshrouded in this sheet, and then placed with that sheet into the body transport bag, and it's zipped and sealed with that zipper, zip tie type of seal with a unique case serial number on it. And then that bag with the body inside is placed onto a gurney, much like a hospital or that an EMT uses, a collapsible one that goes to the ground. Placed there, brought up, and then the body transport people will move the body out into their vehicle and bring the body to our office.
Okay, and so to do all of that, if there was like vetting linen or other evidence, do the medical examiners take that other evidence to your lab, or does that go someplace else?
No, we do not want that evidence. Our focus is the body. If there's something wrapped around the body or on the body or in the body, then that will come with us. If it's just sitting there at the scene, we don't want the pillow. All we're going to do, if it does come, is set it off to the side and give it right to the investigating agency anyways. So our medical legal death investigators leave those items there at the scene, and whoever's in charge of investigating the scene will collect it if they want it, or leave it if they don't. That's not up to us.
And you have also earlier in your answer used the word examination, that the medical examiner's personnel. What type of examinations do they do in the field to a body?
Well, sure. They're at the scene. Mr. Leyva would make observations of body position, how the body's found, any kind of hemorrhage or any bleeding, any materials on the body surface, clothing, that sort of thing. Also, he would make observations about rigor mortis and liver mortis, the lividity of the body. He might make an observation as to her temperature, at least to the touch, the temperature of the environment. Is the air conditioner running? Is it scalding hot? And then just general scene observations. Is the front door locked? Is it kicked in? Is it kicked down? Broken windows? Anything like that.
So what's already in evidence is Stakes Exhibit 12. There's gloved hand manipulating the jaw. Could that be consistent with the examination that the medical examiners, investigators might do at a scene?
Yes, sir.
Finally, are you able, does the science that you practice, are you able to, for the body to be in the state it was, rigor mortis was easily broken? How soon after death does that process start? And how long does it take to get to what you saw as easily broken?
Well, there's tons of variables that go into that. As I mentioned before, as soon as a person dies and their heart is no longer beating and the molecular processes in their bodies are no longer taking place, rigor mortis, the rigidity of the muscles, will begin right away. In the first few minutes, it's not nearly developed enough to offer any sort of resistance. A person moves as freely as gravity or another force will act on it. But the small muscles are affected first, so the fingers will begin to stay in the position they're in at the time of death. The facial muscles will become a little difficult and stiffer than you would expect. Moving the lips, opening the eyes will become noticeable in about 30 minutes to an hour. If you're well trained, you know what to look for. It's closer to 30 minutes, but at an hour, most people would notice there's something different about opening the lips, for example. But then this progresses and becomes more and more steady as time goes on. And after about 2 hours, a lay person would notice that the hands are clenched, that it's difficult to open the fingers, and would notice that there's some rigidity there. Beyond an hour, then we start to notice in the bigger muscles of the biceps and the legs that it's becoming more difficult to manipulate this body and move this body. By the 3 hour, 4 hour mark, now when a body is moved from one position to the other, the arms and legs are going to stay in that original position, but might still, an average build person take that rigor and move, straighten the arm out, for example. But by 8 hours, it's set in there. For a muscular individual, it can be very difficult, even for another muscular individual, to break his rigor. If he's a fit, early 20s athletic guy, it could be very difficult to straighten that person's arm out after 8 hours, after 10 hours. It's going to be set very well. After that peak in the 8-10 hour range, then the opposite effect gradually starts to happen. And it does take another 8 hours or so before it's gone to the point where the arms and legs move with little manipulation and can easily be straightened out. Tons of factors influence that. In a very cold environment, like our walk-in cooler, our incoming cooler, that's the reason why we put them in a cooler at such a low temperature. We arrest that process, and wherever they are, when we put them into that environment and get their body temperature lowered, they will theoretically, generally, stay in that condition until we pull them out of the cooler and put them back at an average room temperature for the examination. Then the process starts up right away again. So tons of factors go into it. Not sure if that answers your question. Really.
It does. Now, States Exhibit 16, and see, is taken on the thermostat inside her apartment. Are you able to make out that temperature?
Yes, sir.
It's too dark.
I think it says 71 degrees.
All right. Now, 71 degrees, could that retard, or it's a little cooler than the normal temperature in San Antonio? Would that retard or degrade that timeline for the onset of rigor?
That is on the cooler side, and it would slow it down, slow down that process more than if it was 80 degrees or 90 degrees or 105 degrees.
And then once it gets to your facility, the cooler is intended to preserve as much evidence as possible, correct?
So it's intended to prevent decomposition, and the process of continuing through that rigor mortis curve is part of the decomposition process.
So from all of that, could you project an estimated time of death working backwards with the data you know?
Well, there's a couple different pieces of information that can give some insight to this. One is my observation at the time of the autopsy, which is 9 a.m. on October 22nd. Her rigor mortis is easily broken. So whatever position her arm is in, we can easily straighten it out and manipulate her body with very little resistance. So that's telling me that she's been dead on the order of 10, 12, 14 hours, or 28 or 48 hours. So there's a little information there for my autopsy, but a lot of the specificity, the usefulness of that has been erased by her having sat in the cooler overnight until I started the autopsy the next morning. One more significant piece of information for me is the observation Mr. Leva made at the scene when he arrived. And he describes her rigor mortis in her arms and her legs and in her jaw as being on the scale of 2+. So that's on the medium to fixed range. So it's not so stiff and rigid and very difficult to move, but it's there, it's observable. He can feel the rigor mortis, but he, being a grown man and her being a 75-year-old woman, he can move that and manipulate that. But it's definitely there and it's set. So that gives me more information than what I see at the autopsy. He also describes her lividity as being on her back, consistent with the position she was in, but not being fixed. And lividity is the settling of the blood that happens as soon as your heart stops beating. When it quits moving the blood, it immediately will settle to the part of the body that is closest to the surface of the earth. So in Miss Boyd's case, she's lying on her back, so she has what's called posterior lividity, or lividity on her backside. And that is made visible to us by a red discoloration of the skin of her back. And it's darker red compared to the front surface in this case, except for where her body is touching the ground or touching another object, and then it's blanched. And that's because the blood vessels are being compressed and blood's not allowed to trickle into there where she's touching the surface. But in those parts of her back that are not touching anything and the skin is not being compressed, then we can see the lividity. And Mr. Leyva described that it was not fixed. That means that when he presses against her skin and moves his fingers, he can see the outline of his fingers. If he presses the thumb and moves it, he can see the white blanching of his thumb, and then he can watch it return and become red again. And that tells us that it hasn't settled yet. The lividity timeline is close to the rigor mortis timeline in that it becomes fixed and set in the 8 to 10 hour range after death. When you press your thumb and move it, it doesn't blanch, it stays red the whole time. So the combination of the rigor mortis being described as a +2 and the lividity being not fixed tells me she's dead in the order of an hour, 2 hours, up to maybe 6 hours to get to this point. Maybe even 8 hours, considering that it's 71 degrees, she's nude, the environment is cool, it isn't overly hot. So that's the far end, but it's more likely in that 6 hour range, or even a little less.
Thank you, sir. I have no further questions, Your Honor. I pass the witness.
All right, defense.
Thank you. That's consistent with her being seen watering the plants at 8 a.m. that same morning, correct?
That would be, my investigator's on scene at 4:39, making his observations. So 8 hours before that would be 8:39. So that would be at the very far extreme end of possible realms, considering how Mr. Leyva described rigor mortis and liver mortis. That would be at the very far extreme.
Is that a yes or no? I mean, somebody said they saw her at 8 o'clock in the morning a lot.
It is possible. Yes.
Okay. And your job, I mean, let's be frank, it's not an exact science. Your answers, it's are possibilities, not certainties, right? For example, this broken rib thing. He's making a big deal if a 340-pound guy sat on you, it's possible you could break 15 ribs, right?
Yes.
It's also possible if two guys come in and kick the crap out of you and beat you, you can break 15 ribs, right? Okay. And right-handed, left-handed, she's beat on both sides of her face, consistent with the possibility of multiple people beating her up, correct?
That's possible, yes.
Okay. Now, sexual assault. I didn't hear you describe any evidence of sexual assault. There's no vaginal tearing, correct?
That's correct.
There's no anal tearing, correct?
That's correct.
Okay. Now on the pictures, it looks like there's some smeared blood. Is that what that is? On the neck and face region, there's some smear marks. Is that smeared blood?
Well, I guess, you have the photo
I do.
taken up.
I don't, but I will. How about that? I shouldn't say I do. Thank you, Steve.
I think the autopsies are more on the top.
Okay. May I approach, Judge?
Yes.
Like some of the, like, for example, in 41, is any of this stuff smeared blood, or are those just results of injury or post-traumatic injury results?
Yeah, so none of this, in this photograph is smeared blood.
Okay.
These are abrasions straight through the skin and
Okay.
bruises.
Now, you took DNA, you said, for the sexual assault exam, anal, oral, rectum. You said that you think that perhaps she had been asphyxiated, correct? Choked?
Yes,
So did you take DNA samples or swab her neck?
I did not.
Are you familiar with transfer DNA? Right. And am I correct in stating that if I was to grab Lindsay by her neck with my hands, my DNA could be transferred onto her neck?
It could be, yes.
And if you swabbed her neck, subsequent to my grabbing her, you could find my DNA on her neck?
It's possible.
Okay. I don't see pictures, or I didn't hear you use the word ligature. Is that because you didn't see anything consistent with the use of a ligature?
I didn't see a ligature, or I didn't see any marks on her neck that looked like a ligature.
Now, one thing I am concerned about is your testimony relies on your medical knowledge, and you testified that the liver was on the left side. Your liver is on your right side. Am I correct? I mean,
It is on the right side.
yeah, you said her liver's on her left side.
Oh. I misspoke.
Oops, okay.
Apologies.
Any reason why your examiners would tamper with the scene and move evidence around?
No.
Shouldn't do that,
Well,
as far as you know? You weren't there, right?
I'm not sure. Well, what question am I answering? Well, I guess it depends on what you call evidence, but there are reasons why my medical legal death investigators would move objects at the scene. But
They weren't originally underneath the victim.
well, they would place the white sheet under
The things they brought with them, right?
Right.
Okay, but not things that were already there.
You know, I wasn't at the scene, so I don't know what they would or wouldn't do, or why they might do it. But generally speaking, we don't. Our investigators don't tuck items underneath the seat.
Okay. The wounds on her hand, you said they were, once again, did you say they were defensive wounds or they could be defensive wounds?
Yeah, I said they're the type of injuries that could be defensive.
Right. They also could be wounds from lots of things, correct?
That's true.
Okay.